Well, hello and welcome to this public lecture organized by the Ottawa Network for Borderline Personality Disorder. We're recording this lecture on the 18th or 19th of June, rather, and our topic this evening is mental health care at the Royal. My name is Floyd Kelly. I'm a volunteer family connections course leader and also serve as a member of the ONBPD board. The Ottawa Network for Borderline Personality Disorder is a registered charity in Canada consisting of volunteers who deliver the Family Connections training program to families and loved ones of individuals with BPD. I'm also delighted to introduce Danielle Langlois, our CIO and fellow Family Connections course leader, and Natalie Barnes, who is an ONBPD volunteer. So during tonight's presentation, all attendees are going to be set to listen only and view only mode. Cameras and microphones will be turned off. If you'd like to ask a question, just submit it using the Q&A tool. And you can remain anonymous by checking the anonymous button. We ask that you do not include any confidential, private, or identifying information in your question. And tonight we are going to have two presentations. The first by Cara Vaccarino discussing the Royal strategic direction, followed by a Q&A. And then the second portion will be a presentation on the resources available at the Royal and how we as family members can access that, delivered by Letitia Energy and Shona of the Family Engagement and Experience team. So with that, it's my distinct pleasure to welcome our first speaker. Cara Vaccarino was appointed CEO of the Royal Ottawa Healthcare Group in January of 2024, following healthcare leadership roles as the Chief Operating Officer at EHN Canada, Director of Mental Health at Trillium Health Partners, Director of Medical Affairs and Special Projects at CAMH. She has a clinical background in social work and started her career in academic research roles at both McGill and UCLA. She holds a master's in health administration, a master's in social work, and a BA in psychology. I want to thank you, Cara, for taking time out of your busy schedule this evening to join us, and we really look forward to your remarks.
Absolutely. Thank you so much. Can you hear me?
Yes, we can.
Okay. So it's an absolute pleasure and an honor to be with you this evening. I'm doing my best to navigate some technical challenges. So I'm at an event actually. So I stepped out because I felt that it was so important to meet with you this evening and to be accountable to our community in very important and new ways in terms of bringing more accessibility to our community for the programs and services we provide at the Royal. So I am going to go through our new strategic plan. We actually launched the strategic plan internally just this week, just yesterday, actually. So you're the first formal group that I'm sharing with this with outside of the Royal. So I would love some feedback and advice after the conversation this evening in terms of what you may want to add or comment on. But this is our new strategic plan that will take us through the next 3 years. You're going to notice that there's a lot of table stakes in the conversation this evening. Table stakes in terms of sort of getting back to a lot of basics. For many of you who may work in healthcare, you may agree with the fact that the COVID-19 pandemic really did wreak havoc on the healthcare industry, and in ways we are still learning to negotiate, particularly in the way of healthcare human resources and the crisis we continue to face in terms of shortage in medical staff and nursing and allied health professionals. So that is all to say we have I think seen the worst of those challenges, and this strategic plan is really about regrouping and setting a stage to take better care of many more people across the region. While I go through this conversation this evening, I'm going to add some color, if you will, in terms of people with borderline personality disorder. As a clinician who worked many, many years on the front line with patients who both had early childhood trauma and eating disorders, those are patients with a high degree of co-occurrence or comorbidity for borderline personality disorder. So I have seen in a very real sense some of the challenges that families face when they have a loved one struggling with borderline personality disorder. And I think more than any other clinical population, people with BPD face unique challenges in ways that maybe more visible disabilities don't. So we can sort of make this an iterative experience. And if you have any questions, comments, or concerns, just let me know. So here we are, SPARQ, lighting the way to better care for mental illness and addiction in our region. So SPARQ was the compilation of tons and tons of consultation, both internal to the hospital and external with our community mental health partners, as well as our hospital partners. And more than ever, we've taken a systems approach to our strategic plan, really trying to step up and lean in bold new ways in terms of creating much more accessibility and higher quality care across the board. So if we can advance the slide. Okay, so as I said, this is a 3-year strategic plan. We did tons and tons of research in olden days before COVID. Most hospitals charted a 5 or even 7-year strategic plan. The best practice now is much more abbreviated to sort of be able to be more proactive with shifts and changes in the industry as we move forward in unprecedented times. So it is our roadmap to the future of mental health and addiction care in our region. So if we can advance the slide, Danielle. Okay, why now? Why now? Well, I probably do not have to tell you that we are facing unprecedented demands for high quality mental illness and addiction care really across the planet. We have seen very unique and specific impacts of COVID-19 on the psychiatric well-being of many people who had mental illness or addiction. Many of them got more symptomatic during COVID, and some people probably who never would have faced psychiatric illness developed them because of the isolation and other social impacts of the pandemic. So we see the need for accessibility at really a degree of urgency. We also see high demands for emergency care across the region. Emergency psychiatric care is at an all-time high. The Royal closed its emergency department about 25 years ago, and we haven't had until this strategic plan a way forward in terms of creating a direct access point to the Royal. So you'll see that one of the ways that we will be improving access to the Royal's programs and services is through the opening of an urgent care service, which will be coming sometime this fiscal year. As I said, we have faced unprecedented challenges post-COVID. The Royal also has had some challenges in turnover with its management and its leadership. And so we're just really regrouping. I'll also say we had an all CEO and chair and CFO meeting with the Ministry of Health just last week. And the Ministry of Health in Ontario has actually seen a need to what they're calling resetting the healthcare system across Ontario, because we're seeing unprecedented wait times for emergency services, for surgical procedures, and they're going to be infusing money into the system to help us reset. So we're looking forward to having some more resources on the table to help recalibrate what we're doing. Okay, if we could move ahead. So this is our new mission and vision statement, and I'll just read it out for clarity purposes. Our new vision is lives reclaimed from mental illness and addiction. And our mission is we advance specialized care and strengthen our region's capacity to help people with mental illness and addiction through treatment, research, education, and partnership. You'll see that these are pretty direct and clear vision and mission statements that really sort of bring us back to our fundamental purpose in the system in terms of being a regional player and part of a larger system of care that's integrated and collaborative. So we're taking really strategic and disciplined approaches with our community mental health partners as well as our hospital partners to really look at developing a system of care rather than a siloed of care. One of the most exciting things that I would like to tell you about is the fact that all of the hospitals in the Champlain region will be moving to one single electronic health record. So through the Atlas Alliance, which is hosted out of the Ottawa Hospital, pretty much every hospital in Champlain region is moving to Epic. This is the best electronic health record on the market, and we will in the Champlain region have the largest single instance of an electronic health record in Ontario. So you're going to see much less redundancy, much more efficiency. If you go to the emergency department at the Ottawa Hospital and you end up at another hospital, we're going to all have one chart, and you'll have much more seamless delivery of acute care and specialty care services across the region. If you could advance the slide, please. So the values that we have used to guide our work really are very much table stakes. I-CARE is an acronym that we have used to identify the values that guide our work in the future. So the innovation, collaboration, accountability, respect, and excellence. These are values that will guide how we treat one another, care for our patients, and serve our community. And we will continue to endeavor to live these values in the work we do and the services we provide. If we could advance the slide. So this is in a nutshell, our strategic plan for the next 3 years. And we've been pretty successful in capturing it in a catchy acronym, SPARQ. So we're sparking the way forward, and SPARQ is an acronym that stands for sustainability, people, access, research, and quality. Basically, these are our priorities. So it's a pretty operational plan. Our aim in the next 3 years is to build a world-class, very responsive, integrated center to treat mental illness and addiction. And our first goal is to really create a much more sustainable operating model in the future. So we have to make some pretty big investments in our infrastructure at the Royal. Not only are we going to be purchasing Epic, where the new electronic health record that will be going live in about a year and a half, but the work is already underway. But we'll be investing in operational infrastructure and ERP, which is a back office system. Many of our systems at the Royal are still manual in nature, and it's really depriving us of the ability to operate a highly efficient clinical operation. So sustainability is really about putting solid operational building blocks in place to help us really move forward and manage our business in a much more efficient way. One of the biggest priorities for the Royal right now is to look at the reduction of overtime. A lot of hospitals saw tons of overtime during COVID, and it's taken us a little bit longer than the pack to stabilize that. So running a tight ship is our sustainability priority. People, we have seen, as I said, huge impacts on culture and well-being across the healthcare human resource sector. We're trying to really focus on cultivating a more positive work environment through increasing transparency, collaboration, engagement, accountability. We opened a staff wellness center just this week to celebrate the launch of our strategic plan. And we're going to really double down on loving our staff ups and really creating a place of deep meaning and connection for them at work. Access, this is my biggie personally. There's some pretty clear opportunities for improvement. As I said, we're going to be opening an urgent care. We're going to be looking at more disciplined ways to manage our our length of stay, and take better care of way more people who are suffering from mental illness and addiction. Research, I don't know if you guys are aware, but we have a world-class Institute for Mental Health Research affiliated with the University of Ottawa here at the Royal. We are a data-driven organization. We actually just celebrated, you'll see on the CBC or CTV or maybe both, news broadcast tonight. We got a $2 million grant from Brain Canada. Just today, we had federal officials in to celebrate. We are also really having a great success in securing philanthropic dollars towards our research priorities, and it's a pretty exciting time for researchers at the Royal. And then quality. Quality is where the bread and butter of what we do at the Royal. So we're really working hard at elevating the clinical platform across the hospital to improve the patient experience, both for individuals and at the systems level. So what does this mean for people with borderline personality disorder? So I think it means a lot. So as I said, I work clinically with specific populations that do see a pretty high prevalence of borderline personality disorder. And I could say that this population is very underserved and really not served at all in most jurisdictions across Ontario. So by that, I mean that we know what is successful clinically, that from an outcomes perspective in the treatment of people with BPD, and that is high fidelity dialectical behavior therapy, which is either not available or very, very expensive to secure. DBT, or dialectical behavior therapy, is maybe you know about this set of interventions, but it basically focuses on skills building, distress tolerance, mindfulness, interpersonal effectiveness, and emotion regulation. And DBT is very, very lacking in Ottawa. So we are going to be opening a DBT program. We have a new chief of staff who's already recruited a physician. We have Dr. Deanna Mercer, one of the provincial experts in DBT, just wanting to start a DBT program for many years. So she's super excited. We just had a field trip out to Montreal to learn exactly what they're doing. And then a number of us have come from the Center for Addiction and Mental Health, where there was a high fidelity DBT program. So DBT is what your loved ones need, and by and large, very few secure DBT. And then what happens is people with DBT face a high, in my estimation, one of the highest levels of stigmatization and marginalization in our system, because they're typically or can be high utilizers of emergency services, and because they don't get what they need with the current treatment available, they end up coming in and out of hospital and not really having the best outcomes that they can. So I get this, and I am making it a personal goal to get a DBT program up and running in Ottawa as soon as possible. We're getting all the components together. We're retrofitting some of the other services that we're providing now to be better aligned with our strategic plan. So the resources are there. It's just going to take a little bit of time to reallocate them and to do some pretty intensive training with our staff. So that's that's the hot news off the press, and I think it would be of great interest to this group. So I'm letting you know, and hold me accountable. Check in with me. Ask how it's going. But I hope to have that up and running within the next 6 to 9 months. So if we can advance the slide. Okay, so this is just, I'm not going to go too much into all of the details around the strategic plan. And you can have a copy of this if you're super interested, and you can follow up with any comments, questions, or concerns. But really, the sustainability goal is around maximizing revenue and funding, being more responsible stewards of the public purse, really improving our approach to risk management and governance, and really elevating the technology that we're using to increase efficiency and effectiveness. You can advance the slide. So this is a super exciting focus. So when I came, I've just been at the Royal for a year and a half. And when I landed at the Royal, there definitely were some pretty significant challenges with culture, lots of apathy and disengagement, as with every healthcare organization. But because of some of the changes and shifts and instability in management, I think things were a little bit worse for folks at the Royal. So this has been a key focus. When I got to the Royal, we did some pretty important work around implementing best practice methodology called REVEL, which is a set of best practices to improve employee engagement and retention. And we have a culture club, and the culture club has representation from every level of the organization, and they give us lots of good advice about the decisions we make. So lots of focus since I've gotten to the Royal on people and culture. But to be honest, there's still a ways to go, and you know we're working at this all the time. This is a big focus of our senior leadership team. And if we can advance the slide, please. Okay, so access, I've talked about access. This is my hill to die on for sure. I want to see much higher service volumes, much lower length of stays, better patient access, better patient flow. So we have an entire project team focused on improving access, and the opening of an urgent care will be the most significant turning point here. So that's all in motion. Probably the biggest update on our urgent care is we recruited really an internationally renowned expert that myself and a couple of us have worked with in the past at various hospitals, an emergency psychiatric expert who's going to come and help lay the framework. We've already been underway with assessing and starting renovations. It's going to be on the first floor of the Royal. So there's lots of things happening on the urgent care side. That's just one way that we're going to improve access. There's lots of other ways too that I'm happy to go into. If you're interested, let me know, and we'll go through to the next slide. And research. I'm not going to spend a ton of time here because we have an entire Institute for Mental Health Research with its own separate board of trustees, its own separate strategic plan. It's very, very important to take care of the patients that need us now, but it's also extremely important to continue relentlessly to look for real cures and ways to improve outcomes. There's a lot of psychiatric illness that is not curable. This we know for a fact. Not to say that people can't manage their symptomology and have very high quality of lives, but by and large, the brain remains a very curious organism, and there's many frontiers to explore. We have one of the only PET MRI instruments in North America dedicated exclusively for research. We run multimodal clinical trials at our Institute for Mental Health Research. The Brain Research Center is a hub of activity, and we're continuing to grow that through support from both the federal, provincial governments, and through philanthropy. It's a shining star at the Royal, and I think you should expect to hear much more about it. I think it's very underpublicized, and we need to really dramatically increase its profile, and we're doing that every chance we get. Okay, and quality. So here we're improving the behavioral and psychological interventions that we're providing in our inpatient unit. We're adding different levels of care, including partial hospitalization and intensive outpatient. We're adding programs and services for underserved populations, such as the Borderline Personality Clinic that we will be opening soon. We are also going to be very responsive to what the system needs, what our community needs, and really the conversations that are taking place across Ottawa are our systems conversations. We're working much more closely with the Ottawa Hospital, trying to coordinate a total continuum of care across the city, avoid duplication, fill in gaps. So there's lots of conversations that are taking place across the region that are pretty exciting in terms of advancing our ability to take better care of more people. And we'll go. So it's an ambitious plan. It's very operationally focused, but and it will require tons of work and lots of focus on people and culture. We remain committed to open and honest communication with our community. We are here for you. We are public servants, and we need to be responsive to the needs of patients and families like yours who are looking for solutions to help the people that you love and care for. And I'm a social worker. Really, that's what I am. I do identify that as that more than anything else. And I'm here for you. I'm very accessible. If you have any questions, comments, or concerns, I'm totally here. You can reach me at cara.vaccarino at theroyal.ca, and we can take the slides down now. And that's 30 minutes, and we got 15 left.
That's wonderful. Thank you, Cara. We so appreciate you taking time away from your event to speak with us this evening. And also, I think I speak for all of us when I say how much we appreciate your deep empathy for our loved ones and your desire and commitment to really further improve the research, clinical practice, and accessibility of services at the Royal. We're, of course, over the moon about the commitment to creating a DBT practice. Certainly, I mean, my family had no access to such a thing at the times we were going through that. So that's incredibly welcome news for so many people in our community. Also, this was the first time I think I caught that you're creating a borderline personality clinic, which is outstanding. And also the urgent care clinic that you're working on, I think is really, really great news and may actually play into the answer for one of the questions that's been
Yeah,
posted here.
yeah. And just remember, it's typically clinically counterindicated to hospitalize people with BPD, but
Right.
oftentimes people get hospitalized because they have nowhere else to go, and the families are desperate and scared. And but if when we have an urgent care, people with BPD can come to us. We know what to do. We can stabilize, we can contain, we can reassure, we can keep people out of hospital. Every time someone goes in and out of the hospital, to me, that's not a helpful thing. Um,
Right.
so I hope the urgent care can fill a gap that could provide very tailored and customized comfort and skills to meet the needs of your family members, because typically emergency departments in general hospitals are extremely overwhelming to people with these personality traits, and it just exacerbates the problem. It actually, so we're designing the urgent care with a lot of ergonomic considerations, a lot of color, a lot of temperament. There's a whole science behind psychiatric emergency and urgent care. So it's going to be a good thing for the community. I'm sure of it.
So, since we're on the topic of the urgent care, I'll read this question first. So, the question is about someone, an adult child who was sent to emergency at other Ottawa hospitals, placed on a Form 1, but then there was no ability to transfer from there to the Royal. They just waited until the person was safe and then discharged. I guess the question is really, how does one access the Royal Ottawa on an inpatient basis in that kind of a situation when the other hospitals are not facilitating a transfer?
Um, so it's very hard to access the Royal. That's the first feedback and most consistent feedback I've gotten since I came to Ottawa is how hard it is to get into the Royal, not only from patients and families, but also from other hospitals and other community mental health providers. So I acknowledge mea culpa, the problem's real, it's significant, and there's lots and lots of reasons for that. I'm in operations, a clinical operations person. I believe strongly that without a pressure point in a hospital, there's no flow and there's no direct admission point to the Royal. So the urgent care will be that pressure point that will accelerate flow. There's a stagnation in the Royal in terms of length of stay. It's longer than the provincial average. It shouldn't be, but so there's a pressure point that will increase the flow. That the other big thing that's happened at the Royal is back in December, in the wake of some reputational challenges ongoing around access and with some issues around our medical staff and our new chief of staff. She left after 5 months. She quit. So I commissioned a medical leadership review, and Dr. Jeff Turnbull, who's like the doctor of all doctors. He's in Order of Canada winners. He was recipient. He ran the Ottawa, the chief of staff at the Ottawa. Beautiful man. He founded Inner City Health. Anyways, he came and he gave us a full medical leadership review, and he made some very dramatic, significant recommendations for change, which were endorsed by the board. And we are in the process of recruiting 3 new medical directors and a new senior medical officer. So we are being very deliberate and strategic about the types of folks we bring on, people with very contemporary practice that know operations. So it's really about accountability, to be honest. That's what we're elevating across the board. We have beautiful, kind, excellent clinicians, physicians at the Royal, but we don't take care of enough people. So in our new approach, it's better to take care of many more people rather than take super duper Cadillac care of a few. So it's a matter of how do you judiciously ration limited healthcare resources. And in the past, the Royal has taken a very different approach than we are now, who are running the hospital. So I was able to get Dr. Benoit Malsant here when the last Dr. Northcott, the last chief of staff, left over after just 5 or 6 months. Dr. Malsant is here now. Dr. Malsant was the chief of staff at the CAMH. I was his right-hand person for 8 years at CAMH, and then he just finished his second term as the chair of the Department of Psychiatry at the University of Toronto. He is probably one of the top psychiatrists in Canada, and he has been gracious enough to give us a couple years here in Ottawa. So the goal is to hire a senior medical officer that will be mentored by Dr. Malsant to take over. So I'm thinking succession, I'm thinking ahead, but it's really about accountability and a very different philosophy about how we're going to move forward in terms of taking better care of more people.
That's wonderful and very responsive to, I think, the needs and concerns of, many people in the community. Just on the point of this particular question, would it be that paramedics might actually deliver to urgent care as opposed to at the Royal rather than to other hospitals so that we wouldn't be in this loop of having to refer across?
Yeah, excellent question. So so now that we got endorsement by the board last month to move full forward with a business plan for a community urgent care, the planning table for urgent care, we are including some primary care doctors, the Ottawa Paramedic Service, Ottawa Hospital. So think of the Heart Institute. The Heart Institute is what the Royal should be. So with the heart, if you're having a heart attack, Ottawa paramedics they have a triage algorithm. So they know who to take to the Heart Institute, who to take to the Ottawa Hospital Emergency Department. We're going to work with, just like, this isn't rocket science. We're not reinventing the wheel. This is standard this is how it works in high performing systems. So the Ottawa paramedics are at the table. They're going to learn who's suited for the Ottawa hospital, who's better suited for the Royal. An example would be if there's somebody who's tried to commit suicide and has some type of wound or has hurt themselves physically and they have a psychiatric illness, they would probably go to the Ottawa hospital because they would need medical attention, physical medical attention, as well as psychiatric attention. Whereas someone who may be just, less severe or less acute would come to the Royal.
That's great. Thank you. Danielle, would you like to read the next question?
Absolutely. So many people with severe mental illness suffer from anosognosia, which is the lack of insight into the fact that they are ill. And according to the Treatment Advocacy Center in the US, 50% of people with schizophrenia and 40% of people with bipolar disorder suffer anosognosia. So it's the number one reason such people stop taking medication or avoid treatment. And it's a major challenge to serving this population, including people with BPD, with programs such as CBT or DBT. So the question is, does the ROH factor in awareness of anosognosia in its training and awareness programs?
That's our bread and butter. That's what we experience in our work from the time we are young clinicians till this very day. It's the nature of the illness. Of course, that's part of all of our clinical training. And it's not always about denial or resistance there really is a lack of insight, we call it, that in a lot of patients who experience severe and persistent mental illness. And you're right, the main outcome is a lack of adherence to medications that they most of the time really, really need. What I have as a clinician, like sometimes the best you can do is to try to provide skills, coping skills, concrete skills. That's why I think DBT is so effective for people with borderline personality disorder, because there often is a real lack of insight or ability to really acknowledge limitations. But most people are pretty open to learning skills to move through the world in a more effective and less painful way. So I have found you have to start where the patient is and in a respectful manner, try to educate them about what the skills could be. If they're learning interpersonal effectiveness skills in DBT, they're going to make more friends. They're not going to be as lonely. They're not going to be as isolated and depressed and sad. So it's, as a clinician, yes, it's part of all of our training, and we try to learn to start where the patient is and navigate that lack of insight or resistance in as constructive ways as possible. But I feel your pain, and as a parent, I have worked with many, many families in my 35-year career as a clinician, and I really feel for you. I really feel for you. It's so tough.
Thank you very much.
I would also like to add some level of support group in this. I can't promise the moon, but in a really high performing DBT, BPD program, there's a family component and education. Actually, I think you have that through your network, right?
That's right.
Yes.
That's what we're hoping to partner up on. So
yeah, so we can talk about who does what and why and da 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 da. And yeah, it'll be nice to work with you for sure. We're on the same page, I think.
Yes,
awesome.
We are. Awesome.
Natalie, will you ask the next question, Natalie?
Sure, thanks. Cara, so this came in by email to our ONBPD group. The question is, will these changes allow all special needs adults with complex medical needs to finally have access to psychiatric services at the Royal? So I think, it's about the complex medical needs. Yeah.
So no, we're not a medical hospital. We're a specialized psychiatric facility. Right. So those are also patients who fall through the cracks, people with medical conditions that are atypical. And oftentimes no one knows actually what's medically wrong. I think I get the vibe of your question. Now we'll do psychiatric consults and partner with our medical partners at any hospital, but we don't have that's not our role in the system in terms of managing medical issues. So, but coordination and integration of services is very, very important.
Thanks.
Okay, another participant says, it's so exciting to hear the developments and strategic plans you're working on at the Royal, and so important to the BPD population. So, do you foresee accessibility will not only serve those in the youth category, but also older generations? And second, do you
So,
see it?
yeah.
Sorry, go ahead. Answer the first one.
Okay, so we have probably our most impactful program is the geriatric psychiatry program. It's a regional program that's very actually there is high accessibility already in that geriatric program for the most part. So we already have designated, and those services work, unless you can tell me otherwise. And then the youth thing, we're working with CHEO and our community mental health partners to take a much more coordinated approach. The Royal's probably going to focus more on transitional age youth, and CHEO's going to focus on the younger kids. We're going to look at a lot of people fall through the cracks after they drop off at 18 years old. I'm
Right.
sure many of you with family members who have BPD have witnessed this firsthand. They just sort of get, oh, you're 18, see you later, good luck. And then there's this gap. So transitional age youth services are super important to help coordinate the transition. So that's where our focus is going to be pivoted to. And it's actually evolved organically that way anyways.
Okay. That's great. The second question from this participant was about will, it's not quite clear, but accessibility through OHIP for services. Like we talked about how DBT is a very expensive thing to access privately. Should we assume that all of these services from the Royal would be covered under OHIP?
Yeah, we don't provide any private services. All
Yeah.
of our services are publicly funded.
Okay, great. Danielle, did you want to ask another question?
Yes. So we have received a number of questions about access to the BPD clinic or the DBT program that you'll open. So will the BPD clinic be available to those who have substance use disorders?
Good question.
Yeah.
So my pet peeve, it really actually triggers me. And I was raised professionally in the United States, and now there's lots of problems with the US healthcare system, but this is not one of them. But coming to Canada, if you have a substance use disorder, you can't get this program. If you have this and a substance, you can't. So there's a ping pong effect. I don't believe in that. One of the big problems at the Royal is the exclusionary criteria is too high. That's where these new physicians are going to really help create a more contemporary, responsive services. So you're going to see as we move forward with our progress, much less of that. I promise you that. We have some services now that exclude you if you have even marginal substance use, and that our guys like drugs and alcohol. Like I don't know what's so confusing about that. They use drugs and alcohol to medicate and cope, and it's very bizarre that's an exclusionary criteria. I don't believe in it. So give us time. It's a lot to move, but philosophically, we're aligned with taking down as many barriers as we can to our programs and services. But it's been like this way for a very long time. We do have an extremely competent, well-educated new senior leadership team, super experienced. When I came a year and a half ago, I was able to bring as an executive clinical VP with me who worked at CAMH for 30 years. She just retired. She's here in Ottawa. She's been here. We're fixing it. But no, I don't believe in all that. It's ridiculous, to be honest. That's my personal opinion. So
And
I'm on your side there.
that's great. And what will be the criteria to access the DBT program? Will it?
You're gonna have to wait for that.
Okay.
But I promise you can ask me that when we have that developed.
Okay.
But maybe you guys can be the main liaison to that group, and we could keep you posted as our development of the program continues.
That would be great. Thank you so much.
Well, we so appreciate you taking time away from your event this evening to talk with us. It's just so wonderful to hear it directly from you, the direction
Yeah,
that we're going to have at the
anytime.
Royal and how we can partner up to make things better in our community.
Anytime. Thank you so much for your time and consideration. And I think you have my brilliant colleague up next, Letitia.
We do.
Okay, and I'm going to leave you now, okay?
Thanks so much.
Thank you
Good
so
night.
much. Bye-bye.
Bye-bye.
All right. And actually, I have a couple of links that I will share in the chat here to areas on the website, the Royals website, where you can get more information about access as well. But now it's my pleasure to introduce the second presentation of the evening, which will highlight the services available to families and at the Royal, to patients at the Royal, and how families can access them. So joining us now, we have Letitia, a social worker who's supporting families at the Royal, who acts as the coordinator of the family and client experience team and facilitates the Family Advisory Council. Joining her is Energy. She is a family peer supporter who's passionate about creating safe and inclusive spaces for healing. She is also a dedicated artist and advocate in the community, centering on compassion, accessibility, and care. Shona also is supporting family members with a focus on building supportive communities and breaking down stigma, something we all like to try and fight. She enjoys uniting both family members and other parties around the themes of coping, support, and inspiration. Welcome to the three of you.
Thanks very much. Thank you for having us.
Okay, so we will just be sharing our slides shortly. And I'm assuming everyone can hear me okay?
Yes, we can.
Perfect, thank you. Okay, thank you, Energy. So thanks for the introduction, Floyd. For those who don't know me, I'm Letitia. I'm a registered social worker at the Royal, and my role is Family Engagement and Experience Coordinator. It is a pretty big title, so what might that mean? So part of my role is promoting and supporting a culture that empowers and engages families, friends, and caregivers who are supporting a loved one struggling with their mental health or substance use challenges. I also help to develop and support the implementation of relevant policies and procedures that not only support clients at the Royal, but also families and their caregivers as well. Like Floyd mentioned, I'm the staff liaison for our Family Advisory Council, which is comprised of families, friends, and caregivers who are providing direct support and care to their loved one. And we have the same common goal for advocating for clients and families and partnering with the Royal to really improve the services and supports that are available to families. And another part of my role, I love to look for new ways to improve family services and experiences, hence the word experience and engagement in my title. So I'm always taking the time to chat with families, really hear your stories, understand the different gaps that families are kind of experiencing. And I really take that into consideration when I'm building different programs and workshops for our organization, or even communicating with the different community organizations to see how we can partner together to lessen some of those gaps or wait times, or providing a space. Energy, can you go to the next slide, please? Perfect. So one of the many resources at the Royal that's available to families and anyone really in the community is our Client and Family Resource Hub, which just celebrated its second year anniversary in May. So essentially, it is a one-stop shop for clients, families, caregivers, and really anyone in the community to access reliable information regarding mental health or substance use resources. Our hub is essentially run by volunteer concierges. Sometimes, if you pop in to see a visit, you may see me there. Sometimes our team takes turns kind of being in there to see, how the space is being used. How can we support the folks that walk through our door? And the services that you can get through our resource hub are being connected to our client and family peer support, assistance in exploring and navigating resources and services, not just at the Royal, but also in the community. You have access to a printer and a computer. And I listed our availability at the bottom there. I'm happy to also share a resource sheet with everything I'm talking about right now afterwards as well. But a huge misconception is that our resource hub is only available to families and clients at the Royal. That is not true. It is open to anyone and everyone. We are more than happy to help where we can. And it acts as a connector. So if we're not able to maybe answer something, we'll connect you with the right people to help navigate that. Okay, and the next slide, please, Energy. Perfect. Another service you may not know that you're able to access is our library. So we do have a physical library located on the fifth floor at the Royal. Our librarians are um, extremely resourceful and helpful, and they house a specific collection of books for clients and families. It can be borrowed at any time. You're also welcome to email or give them a call so they can help you kind of find up-to-date answers for, any mental health questions, or they can help you also help you navigate, research on a specific topic or anything like that. They're very open and between the hours. I don't think I put the hours. Oh, I did put the hours on there. Okay. So from 8 to 11 and 1 to 4 p.m. from Mondays to Fridays, you can completely drop in. It's open for anyone. You don't have to be connected to the Royal. It can be anyone in the community. If you're looking for research, literature, or any resources in general, they're happy to help. Okay, Energy, the next slide, please. Okay, so one of the roles, part of my role is creating and facilitating the family information groups at the Royal. So these groups are meant to be educational and they take place every month on the first Tuesday, typically in the evenings. They are usually virtual. Sometimes they do occur in person, depending on the presenter. And they're open specifically for families. Some previous topics include understanding the impact of trauma, understanding the borderline personalities, I put a typo in there. My apologies. Borderline personality structure and its connection to other mental health conditions, and even consent and capacity. So, something I do for these groups regularly is that I take in consideration feedback from families or different things that they're looking to gain more insight on, or information, and I try to find the appropriate person, whether that be staff at the Royal or even someone from a community organization, to come in and to be able to give that presentation live to the families. And they're able to ask questions on an ongoing basis. And I try to do these pretty regularly. Okay, next slide, please. Perfect. Now, I believe with one of the questions that came up with Cara's Q&A was about anosognosia. So I will get into that really quickly. But I do occasionally do workshops which are designed to help families and friends and caregivers who are supporting a loved one to learn and build new skills and strategies to not only support themselves, but also improve their relationships with their loved ones. So one of the ones that we do a few times a year is LEAP. So that means listen, empathize, agree, and partner. And that one's really focusing on folks who are supporting someone who does have anosognosia or isn't really aware or has a lack of insight, into their mental health or that they're not doing well. So that specific workshop is based off of Dr. Xavier Amador's book, I Am Not Sick, I Don't Need Help. And it's an evidence-based workshop that teaches participants how to communicate with their loved ones who are struggling with a serious mental illness, and how to create an alliance to treatment and recovery. And like I mentioned as well, it also helps to support building a better relationship with your loved one or the person that you're supporting. And then emotion coaching caregivers. I don't have the details yet. We're looking to do a series over the summer and into the fall as well. But this is a specific workshop that is evidence-based. It's an evidence-based advanced caregiving tool from emotion-focused family therapy. And it's meant to be an effective skill for that you can use to promote emotional development, behavior change, and also deepen your relationship with your loved one or the person that you are supporting. Okay, the next slide, please, Energy. Yes, so every month I do my best to send out a family newsletter with everything that's going on at the Royal, or even if there's any events going on in the community that may be of interest to folks. So for instance, if Pleo is organizing a specific speaker or series or support groups, I will put that information in there just to try to reach folks so they know what's going on. I know with a very busy schedule and supporting someone, it can be really tough to navigate where to start or even, where to find this information. So usually once a month or even sometimes multiple times a month, I will send a mass email through there, just updating everybody about what's going on. And again, I'm happy to provide that information afterwards if you're not able to kind of take a snapshot of this link right here. And the next slide, please, Energy. Okay. So that is my spiel for this evening. I'm always happy to connect with you. I'm always happy to answer any questions that you may have. I'm open to hearing what you have to, and if you have any feedback for us, or if you have any concerns about accessibility or anything like that, I'm always happy to help where I can and to share information. So that is my presentation for you tonight. And now Energy and Shona will be going into their presentation about family peer support and how to access it through the Royal.
Thank you, Letitia.
Thank you so much. Yeah.
Well, good evening, everyone. I'm Shona Fleming, and I work with Energy in Family Peer Support, as you can see. And we've been working on this project now since last fall. And we were basically proving whether or not there is need for family peer support. And so far, we have shown the need and are being extended till the end of this year. So that's setting the stage. We started off okay, and we're proceeding for the year and looking probably, we understand Cara is considering permanent positions. So that's how we came to be. We're trying it out and it's working, and they want us to keep going. Yeah. So we'll give you a little bit of an overview about the work that we do. I'm going to start off, and then Energy will present a few of our slides.
Yeah.
Okay, Energy,
thanks, Shona.
Please. Thank
you. Oh, just 1 second here.
Sure.
Okay, we're going to do it manually.
Okay. So as I mentioned, we did have, we were hired on a contract to do a pilot project with both of us working 2 days a week. And what happened along the way is we established a weekly family peer support group, which runs, I guess I should backtrack. I see we're talking about training here. We did get a lot of good training, by the way. Our backgrounds set us up to be selected for the job, but then since they've given us some really good training, what you see here listed, even if you as a person wanted to understand a little more about peer support and this area, there is a free access with the third bullet there. Peer Connect British Columbia offers online course 40 hours worth for training. So it's something you can access. Some of the other things here were paid paid contractors that helped us with training. All right, next, please. So what I was starting to say earlier is so far to date, we've been able to establish a 6-week family peer support program where we offer a closed group such that we have up to 8 people participating, and then the members are more familiar with one another. And each week we have a topic that we explore, and the group discusses amongst themselves, and we come back to look at it. When we did our first cohort of family peer support groups, we learned pretty quickly that the participants were really hoping not to be, sort of left to their own. And we then decided it would be helpful to develop what we call a monthly booster group. And so they were really just glad to be able to come together again. And with the booster groups, basically, we do continue to offer topics, but we welcome our peers as they finish one of our support group cohorts. So after the 6-week period, they come along to these boosters, and the boosters are drop-in, so a little more easy to attend probably for some of them. And then I know that we do one-on-ones. Energy and I often try to be together in a one-on-one with our family peers. Mainly because we can offer more depth of experience and perspective if we're both there. Demand is growing a lot, and we're likely to soon be just doing one-on-ones with each of us individually with people. So we've seen a growth in that area as well. We try to stay flexible. So far, we've been offering those in-person, by phone, and Zoom. We've also done hybrid meetings whereby someone might come into the office, but their family member is somewhere else, and we just get them on the Zoom call. So we try to be accessible. Okay, next slide, please. So four cohorts to date, and I did mention that we had 8 in a group. We have been tracking progress with our post-evaluation survey as well, which has been consistently quite good. We evaluate components of what we talk about, as well as whether or not we're addressing some of the peer values that matter very much professionally, and that's been going fairly well. Once they finish, I did mention they can do the booster groups. They can also continue to come and see us one-on-one if they wish. Okay, so now I think we're caught up pretty well. Also, I think you just saw Letitia's presentation, but we always recommend that you sign up for her newsletter. It's really, really informative. As a family person, I find I'm always learning something in them, but also that there's such a variety of topics being offered, and it's worth your while to be able to see those and access those. In the future, family peer support groups, because we got approved, we're going to be able to start those up again after Labor Day, and it'll be back to the 6-week format. We're debating on if there will be a second group maybe offered by Zoom in a different time of day. We're just formulating what those groups will look like for September. And basically what we have found is the topics that we talk about weekly seem to resonate with the members. And so we've basically been reiterating them at the suggestion of our boss, who thought that would be kind of the simple way to go about it. And it's been working. So we continue that. The booster groups address different topics than our 6-week topics, and tend to reinforce some of the learnings in the 6-week topics. And let me emphasize that we're coming to you with lived experience, not clinicians. So when we present things in these groups, we are generally sharing things that have worked for ourselves. And then we send to Letitia or ask questions when there's something a little more clinical.
Yeah.
Right.
Thank you, Shona.
Thank you.
I think you talked a little bit about our future booster groups here already. But yeah, so just to kind of further reiterate what Shona was saying, we do have our booster groups, and those were formed out of feedback from our first cohort, actually. So we're currently in our 5th one that will begin in September. And after our first one, because it is only 6 weeks, folks were like, we still want to connect after this, like, where can we meet up? And so that's how we started the booster groups. And yes, we do have a topic for our booster groups fourth Tuesday of every month. It is a drop-in, like Shona said, so it's not mandatory. You don't have to come. Depending on the topic, you might see that as a good fit for you. You might want to come on that night. Um, we also will occasionally have a guest speaker. So that is a bit different than our regular 6-week family peer support group because we don't have guest speakers in that. It is just the peers and us and just sharing our lived experience. But with our booster groups, we do kind of take it a step further and we'll occasionally have guest speakers that will attend. Um, and then, yeah, sometimes the participants in our groups kind of create their own meetups on the side, which is also really lovely to see that the connection kind of still keeps going. So something else that we are working on in the future is the Community of Practice Conference. It is being initiated by our peer leader, Kevin Patrick, here at the Royal. It is for regional peer supporters. It is happening on October 28th. And what we will be doing is, so it will be a conference, but there will also be a section of it where, a portion of it, where there will be breakouts for family peer supporters and individual peer supporters. So something that we will be doing is a 90-minute workshop, but we will also have a booth with information and resources as well. So we've actually received a lot of amazing feedback from our groups. As Shona mentioned, this is a pilot project. So you never know what you're going to hear back. But the feedback has been amazing. It has been lovely. So I find that through just reading the different quotes and the information that we receive back from the surveys, one of the biggest things is that folks always feel like they're less alone. And that they kind of have a sense of community now after these groups, that they've learned new ways to talk to their loved one. So that's always really great. We also do provide everybody with resources in our 6-week, actually in our booster groups as well, but in our 6-week family peer support group, we do also provide resources. And folks have said that those have been very helpful. And we've got some more highlights here as well. So like I said, everybody pretty much said it was really helpful for them. They did say they would recommend this group to other family members, but they would also recommend the one-on-one sessions as well. So that's really lovely to see. Yeah, the feedback has been really amazing. Like I said, the biggest thing is that people feel less alone. I think that I'll speak for both of us, Shona, as caregivers. It can feel very isolating and you can feel very alone and very overwhelmed. And so when you come to a space where you are sitting with other folks who can kind of share your experience in a certain way, to a certain degree, it can feel like you are less alone and that, you don't have to bear the weight of everything by yourself. So feedback has been great. And then did you want to close us off here, Shona?
Sure, thanks, Energy. So basically, we have this straightforward email, peer support hub at theroyal.ca, and we welcome your inquiries, your requests for one-on-ones. You can get on the wait list for September group. Yeah, so we just, we're available for any kind of family peer support we can offer, remembering that we're not clinicians, but we are people who have lived through some things. And we do our best to, I think Energy mentioned earlier, we'll go and look for further resources if we don't have them right at our fingertips. And we welcome anything that you would like to send our way for questions.
Perfect. Thank you, Shona.
Well, thank you all three. So appreciative of you spending your time with us this evening. I know that when I accessed the Royal with my family way back when, it was a very confusing and overwhelming experience. And for folks on the line who have not visited, the Client Hub is what year did that get established? Is it 4 or 5 years old now? 2 years old.
2 years old.
2 years old. So there's probably a lot of people on the call that have not seen that, but it's a great place where you can go in as someone like a family member who's new to the Royal and just learn what mental health resources are available both at the Royal and in the community. And our very own past president Michelle Langlois was closely involved in the establishment of that center. And now we have folks like you, in addition to the volunteer staff there, to help people who are in the position I was in many years ago. So that's wonderful. I would invite any other questions to be entered through the Q&A tool. We have one previously we didn't get a chance to ask, so maybe I'll ask Letitia. There was a question here about help with video game addiction. Are you aware of any programs at the Royal that might be appropriate for that sort of issue?
Probably not at the Royal. I mean, it's always a topic that I can look to chat with someone in our youth program or somewhere else who may be able to give a presentation on that.
Mhm.
It is a good question. Whenever someone kind of comes to me to ask questions about certain resources, I do usually ask, are there any financial constraints or anything like that, just so it can help me tailor which resources in the community could be
Mhm.
great. And if in person would be better, or if online would be better.
Mhm.
I mean, I think like Connects Ontario, a lot of addiction resources should be able to help. And I always encourage people to reach out and realistically, if they're not able to support, they should be able to share some resources that may be a better fit.
I recall Kara saying that sort of the history of the Royal has been to be somewhat exclusionary, right? And to focus on the sickest of the sick, the people, that need very deep attention. And she wants to change that to improve accessibility. And I think the work that the three of you are doing is like a key part of that. Certainly, when I've tried to access the Royal, you're trying to get on waiting lists, and it's just really hard to know where to start and where to begin. And just your ability to answer that question, even though there isn't an immediate program at hand, is so helpful to someone who's got real worries in their family. So very much appreciated. Danielle, do you want to take the next question? Or I guess it's not a question, it's just a comment. You're on mute still.
Yeah. So yeah, it's just a comment, I guess, addressed probably more to Cara. And anyway, so thank you for this. Thank you for your presentation, and super excited about the DBT. Everybody is super excited about the DBT.
Mhm. Well, Danielle and Natalie, do you have any other questions that we might pose to our guests here?
Another question has just popped up, so maybe Natalie can ask it.
Mhm.
Sure thing. So just reading it as I read it. My BPD daughter now lives out of province, but now my 16-year-old grandson is showing signs of dysregulation. Are you aware of any programs that may be available for those in Nunavut? So remote access to programs.
Very tough question.
It is.
So like I mentioned, I am a registered social worker in the province of Ontario, which means I'm only able to practice in Ontario.
Hmm.
So I may know more of the resources here. I do know in my previous role, a lot of folks who lived in northern communities did actually come to Ottawa, or Ontario in general for better resources and services. So it can be a bit complicated because there is that gap. There is that gap to services, whether it be remote or in person. Um, it's food for thought for me because something I'm looking to create. I have been working on it already. It may or may not be helpful. It hasn't been sent out yet, but I am doing a larger resource list, not just for Ottawa, but also the surrounding areas for families and caregivers that's available both in person and virtually as well. I've also been connecting with the different jurisdictions to say, hey, if this jurisdiction doesn't offer a service, will you accept someone who's interested in this from another one? So I'm curious about if you're looking for services specifically for your loved one or for yourself. For your loved one, that might be a bit more complex and it might require referral into a larger community.
I'm wondering with the remote access that we have, Floyd, I'm thinking about, our Family Connections program that is available. It's more for us, it's more for the caregivers of people that support. But if there's other remote programs that aren't limited geographically because of the access to Zoom and internet and those types of things, although none of it as well, maybe also limited to infrastructure like that. Um, yeah. Good food for thought. Thanks, Letitia.
All right. Well, seeing there are no other questions in the chat that I can see here, I'd like to thank all of our speakers for generously sharing their time, their expertise with us this evening, and also for the vital work that you're doing in our community to support our loved ones. I want to thank all of our audience for attending this evening. The recording of today's lecture will be posted on the ONBPD website in a few days, and that will allow you to share it with others who might be interested in this content. I'd invite you all to stay tuned for our upcoming public lectures this fall and join us in our mission to educate our community about emotional regulation skills and reduce the stigma associated with BPD. And this concludes today's public lecture.
Thank you
Thank
so
you.
much for having us.
Thank you.
Thank
Thanks
you.
for having us.
Thank you.